Welcome to my channel.
Today's topic of discussion is shoulder dislocation.
In this video, I am going to explain the anatomy of the shoulder joint, the types of shoulder dislocation, evaluation, investigations, and the management of the shoulder dislocation. The shoulder joint consists of the two types of joints, the acromioclavicular joint and the glenohumeral joint. The acromioclavicular joint is basically the joint between the acromion process of the scapula and the clavicle, and the glenohumeral joint is between the glenoid cavity and the humerus. Shoulder joint consists of four muscles known as rotator cuff muscles: the supraspinatus, infraspinatus, teres minor, and the subscapularis. As you can see in the picture, red one muscle is the supraspinatus, the one in the blue is the infraspinatus, the one in the yellow is the teres minor, and the one in the greenish color is subscapularis. Shoulder joint is having the four ligaments: the glenohumeral ligament, coracohumeral ligament, transverse humeral ligament, coracoacromial ligament. The glenohumeral ligament is basically between the glenoid cavity and the humerus. It acts to stabilize the interior aspect of the joint, and it has a three parts: the superior, middle, and the inferior. The coracohumeral is between the coracoid process and the humerus. It's basically support the superior part of the joint capsule. The transverse humeral ligament it between the two tubercles of the humerus, and it holds the tendon of the long head of the bicep muscle in the intertubercular groove. And the coracoacromial it is between the coracoid process and acromion process of the scapula. It resists the superior displacement of the humeral head. So this picture is showing the different ligaments: the coracoacromial ligament between the coracoid and acromion process, coracohumeral between the coracoid process and the humerus, the glenohumeral between the glenoid cavity and the head of the humerus. Shoulder joint is having the several bursas, but the two most important are the subacromial and the subscapular. The subacromial is located deep to the deltoid and the acromion, and the superficial to the supraspinatus tendon and the joint capsule. And the subscapular bursa is located between the subscapularis tendons and the scapula. In this picture you can appreciate the three bursa: subarachnoid bursa, subacromial bursa, and the subscapular bursa. There are different shoulder movements. The picture is showing the flexion, extension, abduction, adduction, internal rotation, external rotation, and the last one, which is not shown in this picture, is the circumduction. So the blood supply of the shoulder joint is basically from the two arteries, interior posterior circumflex humeral arteries. These are the branches of the axillary artery, and the minor blood supply is the subscapular artery, which is a branch of thyrocervical trunk. There are three types of shoulder dislocation: the interior, posterior, and the inferior. So the first case is a 35-year-old male presented to the clinic with the movement difficulty and the pain in the both shoulders 30 days after an episode of seizure. The patient had not been evaluated by a physician for the shoulder condition prior to the current visit, that is the 30 days without treatment. The patient histories didn't reveal any cause for the seizure, that is there was no history of the head trauma, substance abuse, withdrawal of any pre-existing neurological condition. Further, the patient didn't report any prior episode of the shoulder dislocation. So the physical examination was: shoulder movements were restricted, especially abduction with external rotation, and the pain was elicited with the movement. Distal motor, sensory, and vascular functions were normal. So here are the two radiographs. The one is showing the normal shoulder, and the other one is showing the shoulder dislocation in which the humeral head is out of the glenoid cavity. So basically the diagnosis of this case is the interior shoulder dislocation. Now come to the another case. An 80-year-old woman presented to the emergency room with severe right shoulder pain and immobility. She fell down the steps outside her house and landed on her right side 2 hours prior to presentation. On examination, her right arm is abducted and externally rotated. She has decreased sensation to touch over the lateral aspect of her right shoulder. Radiograph demonstrate interior shoulder dislocation. What are the signs and symptoms of interior shoulder dislocation? The pain, the deformity, immobility, feelings of instability. And the physical examination will reveal the arm is abducted and externally rotated, squaring of the shoulder. This means the loss of rounded appearance of the humeral head and the sharp prominence of acromion, that is the squaring. Axillary nerve neuropyrexia, which means the reduced sensation over the lateral shoulder, and the rotator cuff injury. So, for the evaluation of the shoulder joint dislocation, clinical examination is important, as well as the you can order the plain radiographs of the shoulder joint, and the views will be the anterior posterior, axillary lateral, and the scapular Y views. And the findings on the radiograph will be the humeral head is displaced medially and it will overlie the glenoid cavity. There are other specific tests used to examine the shoulder dislocation, but in this video I will not go into the detail of these tests. The one is the shoulder load and the shift test, apprehension and relocation test, shoulder interior drawer test, jerk test, shoulder posterior drawer test, posterior stress test, and the sulcus sign. There are two treatment options for the shoulder dislocation: non-operative and the operative. Non-operative one includes the closed reduction followed by the sling immobilization, and indication for this is the acute dislocations, and the operative one is the surgical stabilization, and the indication for this is the recurrent shoulder instability that has failed non-operative management in the young patient. What are the complications of anterior shoulder dislocation? Recurrence, axillary nerve injury, and the rotator cuff damage. What is the prognosis of anterior shoulder dislocation? The favorable prognosis is when there is a prompt reduction, and the unfavorable is when there is a recurrent dislocations, rotator cuff tear, old age, and shoulder hyperlaxicity.